Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video and hidden secret number 15 of why you can still have low thyroid symptoms even if you are taking thyroid replacement hormone and even if your lab tests are normal. In this video, in hidden secret number 15, it's due to underconversion of T4 to T3 due to elevated cortisol. In the past, we talked about cortisol when we mentioned that it's a stress hormone that's produced by your adrenal glands. And in the past, we talked about how elevated cortisol can short circuit the little circuit in the brain that helps you to create TSH. And in that particular case, you would not be able to produce TSH, which would hinder your ability to make any thyroid hormone, T4 and T3. We talked about how most of the thyroid hormone created by your thyroid gland is T4, and it has to be converted into T3 in order for your body to use it. T3 is the active form of thyroid hormone. T4 is inactive, it's biologically inert, and it cannot be used. So what the body does is it takes T4, it converts it into T3, mostly in the liver and then also in the gastrointestinal tract. However, most of this takes place in your liver. And there's an enzyme in the liver called 5' deiodinase. And you have to have enough of this particular enzyme in order to be able to make that conversion of T4 into T3. Cortisol has a suppressive effect on 5' deiodinase, meaning that as cortisol levels go up, 5' deiodinase levels go down. So if you have surges of cortisol coming out of your adrenal glands, that's going to hinder your ability to convert T4 into T3. So this will look like on your labs is that your TSH will be normal, your T4 may be normal, your T3 will be low, and you may also have a bunch of signs of stress or maladaptation to the stress response from the adrenal glands. Now, what can cause these surges of cortisol? They're caused by unrelenting stress and the inability to cope with a lot of psychological stress. They're also due to a condition called dysglycemia, which is where you have an inability to properly metabolize sugar that can lead to insulin resistance, reactive hypoglycemia, and also type 2 diabetes. And also chronic inflammation. We talked about inflammation in prior videos. So in order to be able to help with this type of problem, it's not enough just to take thyroid replacement hormone. It's not enough just to get your TSH levels normal and to just continue taking Synthroid. You have to go after the root cause of the problem, and that is by getting your adrenal glands healthy and improving the stress response in your body. You have to go to the right type of doctor that knows how to do that. It's not enough just to get your lab values to normal and to suppress your symptoms with some kind of thyroid replacement hormone. You have to do a little bit of detective work and figure out what the driving cause of the problem is. And you have to fix the adrenal glands. You have to get the cortisol levels balanced in order to get enough 5' deiodinase enzyme to be formed by your liver so you can convert all that T4 into T3. Well, I hope you enjoyed this video and I hope you learned something. If you have any questions, please feel free to communicate with me through my website at integratedmetabolic.com. I'd also like to ask if you could please tell a friend and please subscribe to my YouTube channel. There's a lot of people out there that are suffering with these types of problems and they have no idea what to do or where to go for help. So please tell them about us. Please subscribe to the YouTube channel. And again, thank you very much for checking out this video.